And our next speaker is Lou Black. Lou is the Director of Research and Policy for the Hospital Employees Union. So Lou, the floor is yours. Please go ahead.
Thank you, and happy to join everyone on National Seniors Day. ATU, the union that I work for, represents about 50,000 members, and approximately 1/3 of those are care aides. The vast majority of those care aides work in long-term care. And I think, as other speakers have already alluded to, COVID has essentially put a magnifying glass to the problems and issues that already exist in long-term care. So chronic understaffing, wage disparity and working conditions, that one hasn't been mentioned yet, but those things make it much harder to attract and retain workers, and a lack of accountability in ensuring that money goes to direct care. I would say that that one hasn't been discussed yet either. I want to talk for a minute about the single site orders. I think lots of people tonight will already be familiar with them, but not everyone. They were established back in June, I believe, by the provincial health officer. It's when they were finalized. And what they did was restricted workers to working at just one site if they worked in long-term care, assisted living, or provincial mental health facilities to help prevent the spread of COVID and to ensure that there was enough staff at all sites. And implementation in our province went far better than other provinces. And we can attribute this to the great collaboration that happened between employers, unions, and the Ministry of Health. Government taking a fair approach to workers' wages and making sure that all workers in long-term care were leveled up to the same wage. If they were going to be forced to stick with one employer, then that was important that there not be that inequity. So it's been an excellent example of what's possible in a short period of time with cooperation and a supportive government. The necessity of these orders have made some underlying problems with the system clear, including the lack of continuity. So the fact that many care aides have to hold more than one job because there's insufficient hours or wages to hold just one job was brought to light during COVID. And these standardized wages that have come with the single site orders have been needed for a long time. It's something that we're pretty close to having back in 2001, but the previous government slowly eroded that with their legislative and policy directions. I just want to share a few of the impacts of COVID-related policies. And again, some of them have already been mentioned. The lack of surge capacity meant that when some staff were unable to come to work due to COVID, and in combination with other leaves of absence and vacancies, short staffing was routine. This single site order exacerbated that because there's no casuals available to cover leaves, the regular leaves that staff are entitled to. Remaining staff are often left to work overtime. I've definitely spoke with members that work 7 consecutive overtime days and had to have their vacations canceled and are stretched extra thin to meet seniors' care needs. The impact of short staffing, I think Jennifer spoke to this as well, became more apparent when family members and volunteers who provide a significant portion of physical and psychosocial care were not allowed to visit long-term care. So care aides increasingly spent their time helping residents to FaceTime, we know the stories, and to help their families connect using other means, struggling to try to provide the additional aspects of care that the residents so desperately needed. Then when the essential visitors policy came to be, of course, we're very happy that seniors can see their loved ones again. But their workload volume has intensified again due to the increased work of overseeing safe visits. So in speaking with our members more recently in some focus groups, we found that the care aides are expressing that they're often pulled from their regular work tasks to take residents to meet family members for a visit without prior warning. This isn't happening at all sites. Some sites have a very coordinated program. I've been happy to hear about those, but still there are a number that are not functioning that smoothly at this point. And so in those situations, care aides are pulled away from their regular tasks. It means additional time for our members who are already working against the clock to try to meet folks' needs. Some of the visitors coming in are struggling with the COVID protocols and continue to act as though it's pre-pandemic days, wandering into neighboring residents' room to chat, and there's no assistance or supervision for this situation, yet there's a clear need to be able to support the visitors themselves in this process. In some facilities, there's no staff to coordinate visits on weekends, yet family members show up unannounced sometimes on the weekend. And family members generally are struggling to understand why they can't visit more frequently, quite understandably. And care aides feel that they're bearing the brunt of that frustration. So I'll just close off saying our members are struggling to provide optimal care at the best of times, given the insufficient staffing in most care homes. And they're forced to make the difficult choice between forgoing basic care like baths and getting residents out of bed and dressed for the day, and prioritizing other essential tasks. The pandemic has made the situation worse, and we've heard many stories, as Jennifer was speaking about as well, of members' moral distress and burnout and the emotional impact on mental health. So things that were clear that we need, and this is by no means an exhaustive list, we know that we need a lot more staff, and higher staffing levels must be made mandatory and enforced. We know that the wage equalization that came with the single site orders has to be continued if we're going to stabilize the long-term care force and be able to attract and retain people. We know that a greater portion of the money spent in nonprofit sector of long-term care is realized in actual care hours for our seniors, as a seniors advocate study just last year pointed out. And so we need greater accountability from the for-profits, and we need any new investments to go to the nonprofit sector of long-term care. The announcement, again, Jennifer referred to in the NDP, that was part of the NDP's platform. That's the first investment we've seen of that size going into long-term care infrastructure and into public infrastructure in decades. It's most welcome. It's thoughts on what needs to happen at a national level as well, but I'll save that for later conversation. Thank you.
Thank you so much, Lou. I'm looking at some of the questions coming in. Here's one for you. Do you think there would still be staffing crisis shortage in long-term care if all care aides had permanent full-time positions?
It's an aspect of the issue, absolutely. Even within the health authority owned and operated sites, it's just under 50% of care aides that have full-time jobs. And this situation is exacerbated in private facilities. So it is an aspect, the hours of work, but also the conditions in terms of pay and benefits themselves. There's as much as a $7 an hour gap in pay without that wage equalization that's happened under single site orders. We have to remedy that. We have to make sure that that gets carried into the future and past the pandemic. That's what's going to attract workers and keep them there, in addition to improving the short staffing.
Mm-hmm. So I think this is a related question about this quote unquote pandemic pay. What is your assessment around the pandemic pay for frontline essential healthcare workers? Is this something that will be implemented moving forward?
We sure hope so. The Hospital Employees Union is advocating for it. We think it's essential. I think it's impossible now that people have experienced this to tell them no and to say that we're going to go back to the way things were. And it should never go back to that. We call them heroes. You know, we did the 7 o'clock cheer for many months, and we need to make sure that we back that up with actual investment.
Well, more questions coming. Here's another one. Is it true that for-profits get adequate funding to compensate healthcare aides at the same level as the highest paid, but they don't receive the full wage?
Sorry, can you repeat that?
So is it true that for-profit providers get adequate funding to compensate healthcare care aides at the same level as the highest paid, but they don't receive the full wage?
That's correct. So they do get funded with the same funding scheme. There's a little bit of variation among health authorities, as to how they do it, but they do get the same funding. It's always based on an average, and the seniors advocate would be able to address this as well, as she knows it intimately, given her recent study. So they are funded to pay that wage, and they choose to pay a lower wage.
Mm-hmm. So here's another question, Lou. I'm wondering if you have any thoughts about the fact that most of the frontline workers belong to immigrant, racialized members of the community, and in terms of their voice being heard in a stronger way. So are there extra measures being taken or voices being given to the frontline workers in that sense, given their backgrounds?
We've, in recent efforts between our union and the employers, Health Employers Association of BC, we've been working on recruitment and retention efforts. There is big emphasis there in making sure that there is greater representation and opportunities and promotion to Black, Indigenous, and people of color workers within the sector. That is happening, trying to make sure that there are better conditions of work and opportunities for promotion there. Within our union, that's certainly true. We have many activists, particularly, they do tend to show up more in the contracted support service sector, so we're more privatized sectors. We see that and certainly fight to try to remedy situation.
Okay, thank you so much. Lots of questions coming, but we'll wait for the final round and come back to you.